When I was 11 years old, I was leaving the community center and I slipped on a patch of ice. I fell flat on my back and I laid there for a couple minutes trying to catch my breath. The next day, I was in a lot of pain, so my mom took me to the doctor. The doctor did a couple x-rays just to make sure everything was okay, and he came back with some results that were shocking. He diagnosed me with a condition called idiopathic adolescent scoliosis. So today I just want to share a little bit about what scoliosis is, the different types, and some of the solutions that exist to correct it. So scoliosis is best described as the sideways curvature of the spine. Now a normal individual's spine is vertical, meaning there is no curve, it goes straight up and straight down. And an individual that has scoliosis has a sideways curve. Depending on the severity of the case, sometimes that curve is very small, sometimes it's very big. There may be a curve in the upper back, the lower back, or sometimes both. There are signs of scoliosis, and one of the main signs is a uneven body. So sometimes an individual with scoliosis will have one shoulder that's a lot higher than the other, or similarly one hip that is higher than the other. You may also notice an individual with scoliosis will have a protruding shoulder blade or just one shoulder blade that is more prominent than the other one. And this is due mainly in part to the body kind of working with the curve. Because that curve is forming, it's pushing different body parts around, like the ribs and the shoulder blades, to make room for the curve, and that causes the shoulder blade to stick out where the curve is. And as you can imagine, this condition comes with a lot of back pain. It is typically described as a discomfort and a numb feeling. So between 2 to 3% of Americans have been diagnosed with scoliosis, and about 3 million new cases are discovered each year. Now there are three main classifications for scoliosis. There is idiopathic, congenital, and neuromuscular. So the idiopathic classification of scoliosis basically just means unknown cause, and this is most prominent in adolescents, typically before they hit puberty. They will start experiencing back pain and go to the doctor like I did and discover that they have scoliosis. The cause is completely unknown and usually can become quite severe if it goes unnoticed for a long period of time. Then there is congenital scoliosis, and congenital scoliosis is the result of a birth defect. Typically these are noticed a lot sooner than the idiopathic scoliosis cases because birth defects and children with birth defects are monitored very closely, and because this is a result of it, it tends to be picked up a lot sooner. Similarly, there is the neuromuscular scoliosis, and this is a result of a neurological or muscular disease such as cerebral palsy, and it is usually a result of that disease and can lead to a pretty severe case of scoliosis, and usually those cases tend to progress very quickly. So thankfully solutions do exist to correct scoliosis. The very first step a doctor takes in attempting to correct scoliosis is the utilization of a back brace. A back brace is exactly what it sounds like. It is a hard plastic brace that is worn on the individual's torso to basically hold them in place and guide the spine back into proper alignment. These are typically used on less severe cases where the back brace will be the only solution, and it'll be worn for as long as it takes for the individual's curve to be corrected. But in more severe cases, surgery is kind of the requirement. And the most common form of surgical correction for scoliosis is the use of metal rods. And what a surgeon does is they'll place a rod on either side of the spine and use screws to fuse those rods to the spine, and the rods will act similar to the back brace in guiding the spine back into its proper alignment. Now, this is the most common case. However, Back in January, the very first surgery was completed using a spinal tether as a solution to scoliosis. And a spinal tether is a very tough but flexible polypropylene tether that is fused to the spine using screws. This is a lot less invasive of a surgery than the rod surgery, but unfortunately, because it is so new, there is a lack of information on the surgery. So, although depending on the case of scoliosis and the method required to correct it, recovery time can be between 2 months and 2 years to get back to normal activities. And it is nice though, because eventually normal activities are achievable, and you can get back to doing things like playing softball and horseback riding, and if you're me, hiking volcanoes. So although it is scary to be diagnosed with scoliosis, there is a new life that exists at the end of the line. And I hope you enjoyed just learning a little bit about what scoliosis is, and hopefully you can monitor some individuals and see if they have scoliosis, or maybe run a test on yourself and see if you do. Thank you for listening.